So we're here today to talk about the IDEXX CBC. One thing with IDEXX is you can get the same CBC in-house on your ProSite DX or in the lab, in the reference laboratory. There, you're getting the same information from both of them. You know, in so many situations, the haematology is not necessarily going to always tell you exactly what's wrong with the patient. Sometimes we'll find out if they're severely thrombocytopenic or anemic or things like that. But, you know, it's not always going to give you the specific reason an animal's unwell, but it can give you a lot of information to say that there is something wrong with that patient. So alterations in red cell mass, the presence of reticulocytosis, inflammatory leukograms or stress leukograms can indicate to us that we've got something else going on in that patient that warrants further investigation. Even including CBCs as part of your pre-anaesthetic screens. If you're doing the CBC as part of that, you're going to get a lot of normal CBCs. That's not necessarily a bad thing, but there are certain patients that we will find things like, you know, significant reticulocytosis that may suggest underlying hemorrhage or hemolysis, a significant inflammatory leukogram that marks that we've got something else going on that may warrant further investigation before the anaesthetic, and things like thrombocytopenia. We can have patients with, you know, a platelet count of 20 or 30 by 10 to the 9 per litre that are not going to be showing signs of spontaneous hemorrhage, but if they have a procedure done, they're certainly at significantly increased risk of bleeding. And having a CBC as part of the pre-an is going to help minimise the risk in that sort of patient. Clients these days have an increasing desire to find as much information out about their pets as they can, and they're looking to vets to try and give them advice on preventive care and keeping their pets well. You know, there's evidence out there to show that there is value in adding diagnostic screens to a wellness visit. Obviously, the history and physical examination are central to that, but there are patients that we will find things when we do further diagnostic testing. So we would suggest a minimum database in that setting. So doing a complete blood count, you know, it can be a good marker of that patient has something going on that we need to pursue further. So if the red cell count's high or low, if there's an inflammatory or stress leukogram, if platelets are changed, that's an indication we need to pursue things further. Obviously doing a complete chemistry profile, including SDMA, and that is going to be important. So we can see for early changes in the kidneys or the liver, you know, looking for changes in electrolytes and all that sort of thing. Can't underestimate the importance of including urine in this testing. You know, a urinalysis, a complete urinalysis, so looking at the physical properties with colour, clarity and concentrating ability, doing the chemical analysis with the dipstick, and also doing a sediment examination is going to be very important. I think sometimes we forget about things like fecal testing as well. You know, there are sort of peak bodies like the Companion Animal Parasite Council in the States that talk about the importance of doing, you know, fecal parasitology at least every year, in young animals even more often. So, you know, we can do things like fecal flotations. You can do those in-house, but they're not especially pleasant and the technique is not that sensitive. So you can send samples to the lab to get a flotation centrifugation done, or even these days we now have a fecal antigen profile which looks for antigen coming from adult, whipworm, hookworm and roundworm, and has probably at least twice the sensitivity of doing the flotation centrifugation. So it's a really nice simple way to screen patients for those underlying parasites. And now there's even the option of kits that you can sell to the client. The client collects the fecal sample at home, you include a request form with that, they collect the sample, put it in a jar, that goes in a bag, in a box, pop it in a post box, it comes into IDEXX, we'll run the test here and provide the results back to you in your clinic to share with the client.